Okay, this is kind of an addendum to the MA 180 Skin Prep Competency. I've kind of added a little piece to it to make it a little bit better. So what I want you to do is to add to the previous video that I have posted on the Blackboard page, is once you have your sterile tray set up, I want you to drop 2 more items on there. So you have your bowls, your sponge forceps, your fenestrated drape on there. I also want you to take some suture material, and that should be in your box, and we'll just reuse what suture material is in there. So try not to pull this all the way open. So you're going to drop your suture material onto your sterile field. And then you're also going to drop onto your sterile field a needle holder. So you'll open it the same way, just like you did all the other items, and you'll drop that needle holder onto your sterile field as well. Then the last thing, just like in the other video, you're going to open up a sterile drape to cover your sterile field. So I'm going to cover my sterile field. So that's the only thing we're going to add, is we're going to add dropping a needle holder and suture material with the other items that you set up. Now, at this point in the other video, you'd go get your patient, call them in, verify their date of birth, situate their arm on the sterile field, etc., and then you would uncover your sterile field and pour your liquids. What I want you to do at this point, you have your liquids, you're pouring your liquids, and remember, you can't touch anything on your sterile field until after you have done your sterile gloving, right? So we got our liquids poured, do my surgical hand wash. I'm going to put my sterile gloves on. And the piece that I want to add, after you get your sterile gloves on, then I said you could kind of move stuff around on your sterile field because your hands are now considered sterile. But the piece that I want you to add, and you might want to get in a little closer for this so that you can see, is I want you to take that needle holder, and I want you to take the suture material, and I want you to take the suture material out of its container, and you're going to hold it by the needle. Okay, and on the swagged edge, so right before the thread comes off of the needle, you're going to take your needle holder and you're going to clamp it at that spot. Okay, so see how I have that clamped on there? Now the physician can go ahead and suture the patient's wound. So see how the needle holder is this way and the needle is perpendicular to the needle holder. So after you put that needle in there, kind of go, okay, could I suture a wound now with that? So that's how the doctor's going to use that together. And then you're just going to set it right back down on the tray. Now I don't care if you do this first thing before you scrub your patient's skin, or if you do your patient's skin scrub and then come back and put that needle in the needle holder. But I do want you to get used to applying the needle into the needle holder. So that is the 2 different pieces. I want you to drop a needle holder and suture material onto your tray, and then once you're sterile gloved, I want you to go ahead and put that suturing needle into the needle holder.